On the morning of Thursday, June 30th, 2022, paramedic engine 725 and ambulance 721 were dispatched to a residence in Rockville for the report of a patient complaining of chest pain. The crews were greeted by the patient, who was sitting on the couch in his living room. The patient explained to the crews that he had been swimming earlier in the morning and began to develop some chest pain and discomfort in his arms and back. The gentleman went on to explain that he decided to stop swimming for the time being and to return home. The patient states that the pain and discomfort were still present, and he did nothing that would relieve that. So the patient asked his wife to drive him to the hospital. As the patient and his wife were preparing to leave, the patient's pain became worse, so his wife decided to call 911 for assistance. The crews worked together on scene quickly to obtain vitals, perform a 12-lead EKG, and administer aspirin. The decision was made to have the patient transported to Shady Grove Hospital for further treatment and evaluation. The patient was packaged and loaded into the back of ambulance 721 for transport. While en route to Shady Grove, crews continued to monitor and assess the patient's condition. Suddenly, during transport, the patient became unresponsive and found to be pulseless and apneic. The crew alerted the driver of the unit, and he pulled the ambulance off the road and alerted ECC of the situation and requested additional resources. Master Firefighter Paramedic Haggerty recognized that the patient was in VFib and prepared the patient for defibrillation, while firefighters Hipkins and Sense initiated high-performance CPR and assisted ventilations via bag valve mask. The patient was defibrillated one time, and chest compressions were continued. After 3 minutes of resuscitative efforts, the patient regained pulses and began to breathe on his own. A short time later, the patient regained consciousness and was able to communicate with the crew. Another 12-lead EKG was obtained, and the patient was found to have a STEMI. The crews notified and updated Shady Grove about the change in the patient's condition and sent the 12-lead to have early activation of the cath lab. Upon arrival to Shady Grove, the patient was transferred to the emergency room staff. The patient was stabilized and sent to the cath lab, where he was found to have a 100% occlusion of the left anterior descending artery, LAD, and had a stent placed and admitted to the intensive care unit to recover. Thanks to the skills, knowledge, and teamwork of MCFRS clinicians, the staff of Shady Grove Hospital, the patient was discharged to home on July 3rd, 2022. Okay. Thank you. I have a letter here from the patient that teach me. No. They would like read. As usual, I was doing my morning swim workout when I started to feel soreness in my back and shoulders. I decided to go home and rest, but the pain got worse that they couldn't even lay down. I then decided to go to the hospital, and I was going to have my wife drive me there, but the pain got even worse. Luckily, my wife called 911, and shortly thereafter, Montgomery County Fire and Rescue Service team arrived. They began assessing my condition and quickly determined that I should immediately go to the hospital. On the way to the hospital, I went into cardiac arrest, but as the paramedics were right there, they were able to revive me. When we arrived at the hospital, I immediately went into surgery to have a stent placed in my main artery. By calling 911, I received immediate care before the hospital that not only saved my life, but also saved me from any real danger to my heart. Thank you to the 911 operator for supporting us and staying on the line until the ambulance left. Thank you to the MCFRS team. Thank you to the emergency room heart surgeon and the hospital staff. Our family and I have no words to express how grateful we are for the wonderful service I received. Without your assistance, I may not be here sharing my story. Thank you. Robert and Anna.